recognize our final speaker. We are very honored and privileged to hear from her. She is the 16th Surgeon General of the United States of America. She's the first African American and the second female to head the U.S. Public Health Service. She's from Shaw, Arkansas. She studied pediatrics at the University of Minnesota and then returned to Little Rock to do her residency at UAMS. She became an expert in pediatric endocrinology, specifically in growth problems and juvenile diabetes. It was this branch of science that led her to study sexual behavior. Recognizing that diabetic females face a health risk if they become pregnant too young, she saw the urgent need to talk about the dangers of pregnancy with her patients and to distribute contraceptives in order to limit those dangers. The results of her actions were clear. Of the 520 juvenile diabetics she treated, approximately half were female and only one became pregnant. She became concerned with the large numbers of emotionally immature young adults who were becoming pregnant and has become one of Arkansas's and the nation's topmost advocates for sexual health. She just informed me that they have just created a chair at the University of Minnesota for sexual health education in her name. A most warm welcome to Dr. Joycelyn Elders.
Thank you. You know, the gods even were good to us today. It's a beautiful, it's not, I can't say it's warm, but it's really not freezing, penetrating cold. The sun is shining. But I want to tell you I'm very grateful and honored to be here. I was talking with Dr. Lily Doyle, and I said I remember there were times when there was nobody here but me and you. And we were talking to each other. But I certainly want to thank Ms. Stephanie Arsham with NOW, the ACLU, the PPAEO, and AAUW for organizing this rally in support. We say of reproductive justice, but to me it's a support of human rights. We support the rights and justice for women, children, and girls. The health of a nation is directly related to the health and education of its women. You've heard Pastor Wilson talk about the importance of women. Well, we all know that women are very important, but we all have to start fighting more to make sure that the rights in education and reproductive health of women are recognized and supported. Health care is a human right, not a privilege. And we are pleased that after 100 years that we finally, the United States, finally passed a health care reform bill. I know it's not perfect, I know it needs some work, but we have to start someplace. We have to have someplace to work on. But we have some of our policymakers who feel that we should throw it out and start all over again. No. Well, they've got 100 years to start. No. So let's do some finishing now. I used to tell people all the time that we had spent as much time talking about health care and health care access for all of our people as we've spent talking about that other A word, abortions. We would have long since had it done. But of course, we've got to move forward. We have 310 million people in this country, and we have 30 million that will be covered by this bill. We'll still have, since we have 47 million with no health insurance, you can see we'll still have a lot without care, but that's critical. And you have to know that the people that are most being included in this health care bill are women and children. So we need to be out there supporting access to physical health, mental health, and emotional health. Did you know that 36% of the health care that's delivered for women of reproductive age is for reproduction? 36%. So we got to go out. We need to support this. To support this, it's related to sexual health. I tell people all the time that our sexuality doesn't start at some magic age. It's from birth to death. And it's about what I call the 3 Ps. The 3 Ps are, first we talk about procreation. Well, I feel that a woman should have a child when and if she chooses. To make that decision for her. The second P is about protection. We have to protect ourselves. We need to be protected from unplanned pregnancies, protected from disease, STDs, and HIV. And of course, I told you sex was about the 3 Ps. We talked about procreation, we talked about protection, and the third P is for pleasure. 99.9% of sex is about pleasure. And it's not women are supposed to have pleasure too. So we've got to get, and you have to know, if you can't control your reproduction, you can't control your life. Control your fertility. You have to have greater gender equity. You have to have access to services and resources, as Senator Elliott talked about. And we have to have power over our bodies. We have to be educated so we can be empowered to make those critical decisions. So what can we do as women, as children, as men, as people in this audience to bring about reproductive justice for young, old, rich, poor, black, white? We have to care. And let me tell you what I mean when I say we have to care. I see the sign, many wonderful posters and signs out there, but when we say we care, the first thing we have to do is, for the C in care, is we have to have courage. Courage to stand up, speak up, and be the voice and the vision for the poor and powerless. For those powerless children in need of powerful friends, you have to stand up and do that. For the aid and care, we've got to have access. We've got to be aware of the problems, and we have to make sure everyone has access to the services so they can protect themselves. We say, well, just don't do it. Just say no. We're sexual beings, and therefore we have to do the things we need to protect our bodies until we're ready to protect ourselves from disease. That's very critical. We've got to be, like we're here, we're being advocates. We as women have to be real advocates and work to make sure that these things get done. We've been working for a long number of years, and I'd like to say we haven't made much progress, but you see, I remember when. I'm old enough to remember when. So we've made a lot of progress. I just want to tell you we aren't there yet. We've left a lot of work for all these bright young people that are out here today to do in order to get our country where we need to be. So we've got to make sure we continue to do this. They must continue to work to have an action plan to get it done. We must have health care for all of our people, universal access for everybody. You know, I get mad every time I talk about the fact that we've long out there paying health care insurances that paid for Viagra and wouldn't pay for birth control. So that's because we as women have to stand up to make sure that those things come about and happen. If we had more women in the State House and at the White House, we'd have a lot of these things that are important for everyday living and for women and children to be able to come about. So we've got to work to make that happen. We've got to keep our reproductive rights and freedoms available. We can't allow that to go away. For the R in care, we've got to reach out and be responsible. We've got to make sure that resources are available. Make sure that all contraceptives are available. And make sure that abortion services are available. Safe, legal, rare. We've got to educate. I guess it's time to stop talking. We've got to make sure that we educate and empower all of our young people and all the young people that are around the world so they can take control. And that's what it's all about. So in order for women to take control, we've got to make sure we have clarity of vision. Decide what we want to do, where we want to go, how we're going to get there. You know, you may want to do something all you want, but if you're incompetent to get the job done, you still got a problem. You've got to be consistent. You've got to continually work at it. You've got to be committed. And as you've heard, everybody here has something else to do, even me. But we've got to be committed. The 3 T's of commitment is we have to give up our time, our talent. We've got these wonderful signs, these bright young people. And we have to also reach down in our pocketbooks. Somebody had to give up a few treasures to get all of this set up and working fine. And I want to say thank you to all of those people. So I want you to know a conviction is that we have a passion for change. Think all kinds of possibilities will come about. We must no longer sacrifice. We must work to make sure that we protect our children and our country, whether they're walking around talking about America. I'd like to leave you with an oldie bold thing. Many of you probably heard it, but I'll say it one more time. It says, not to know is bad. You know, if you don't know anything, the ignorance, that's bad. But when you don't want to know, that's good. It's unthinkable. You know, if you don't hope for things to be better, that's unthinkable. But when you don't care,